My father had 4 sons, and he thought we all should go to medicine for a number of reasons. And so I have 3 brothers that are physicians, and I'm one of the 4. We've each done different specialties in medicine, but my chosen field was ophthalmology because I had an eye problem at a young age. And I fell in love with ophthalmology and pursued it. You can tell a lot about somebody's health and their life, etc., with looking at their eyes, looking at their vision, and looking at a thing called the retina of the back part of the eye. Having said that, it's been a very rewarding profession for 45 years. Eyes and expression is a window into the soul, and you know this pretty well. The interesting thing for me is the ophthalmic plastic reconstructive surgery is I can reconstruct the area around the eye, and that's expression and all the things that people put forth to somebody else, how they do things. I'm impressed by the other members. They're amazing people. They've had great careers, and when you look back at your career, you've enjoyed this. As I alluded to a little bit, brothers that are physicians, I have daughters that are physicians, nephews and nieces and all the different things. There's a great group in our family that just loves medicine and has enjoyed it thoroughly. An expression of how do you give back? And I've been a member of this thing called the Hamilton Eye Institute, which is the University of Tennessee, and Ralph Hamilton was a great mentor. He lived many years, and when he was older and had trouble, he said, what you need to do is make a difference every day. And if you can make a difference every day in somebody's life, you have done something. If you live by that, you can have a great time. Medicine is a broad profession. And if you choose medicine, there are many paths in medicine that can fulfill your life. Understand that as you go through this profession, you learn the different things in medicine. Where do you fit? Where can you make a difference? And where can you enjoy your life? That's what I tell them all the time. I'm a native Memphian. I grew up here. And if you ask what's special about Memphis, I have one of my fellows that came through, and I said, we had a fellowship that trained in Memphis and in Nashville. I said, what's the difference between Memphis and Nashville? He said, Memphis has a soul. And if you're with a group of people that have a great history and you enjoy the people, great. Well, if you get with a group of physicians that care enough about medicine to represent medicine, it comes down to a one-on-one relationship with the patient. Every day you see all these patients in your clinic, in your office, and they have problems, and you're trying to help their problems. And a number of problems you can solve by science. But the other problems you have to solve by society. And if you have impact in society, you can try to help some of the things that give them problems all of their life. And so you must be an advocate for your patient, an advocate every day.